are you? It's been a long shift.
Let me tell you, so I'm going to give you a report.
Okay.
You're going to be taking care of Pat Smith, 54-year-old female. She was admitted to emergency room yesterday. She had a pulmonary edema. She does have a history of heart failure. That was diagnosed about a year ago. She is on home medications, which includes Lasix, 20 milligrams by mouth daily. She's also on an ACE inhibitor, but she didn't know the name of it. She just knew it was an ACE inhibitor.
Okay.
She has a history of high blood pressure. Again, like I said, heart failure. She is allergic to sulfur drugs and penicillin. Now, yesterday before she came in, apparently she was home. She was short of breath for about 2 hours before she called the ambulance. And at the time, she did not have any pain or any other symptoms. But she did notice that her legs had been swollen for about the last day or two.
Okay.
Anyway, in the emergency room, she was given oxygen with a breather mask at 12 liters. They just started an IV on her 5% dextrose and water, keep open rate. They also gave her Lasix, 60 milligrams IV push over time. Her vital signs when she came into emergency were 164 of 102 blood pressure. Her respiratory rate was up there at 32. Her heart rate was 124. Her temp was 99. Her O2 sat at that time was 88%. When she was finally admitted to the cardiac IMCU, her vitals were much better. They were 136 over 80. Her respiratory rate came down to 26. And her heart rate came down to 98. And her O2 sat also improved to 97%. And her temp remained at 99. So that's all I have. Any questions before I leave?
Just, are we keeping her at the 12 liters of O2 or what are we doing?
She's on a regular mask now.
Okay. All right.
So you have a good day.
Thank you. You too. All right.
Wait, put it in the wrong place.
Hi, Ms. Smith. How are you doing today?
I'm good. How are you?
I am pretty good. I am Deanna. I'll be your nurse today. I just wanted to go ahead and check your vitals and perform a small assessment. Just so you know, Doc did order some more Lasix for you, 20 milligrams, okay? So before I start, I just want to double check your O2.
Okay.
How have you been feeling today?
I'm alright.
Good. Have you been getting up to walk around much? Have you been feeling shortness of breath?
Just a little bit,
Just a
but
little
I'm breathing okay.
Okay, all right, so let me go ahead and try to check your blood pressure, see what we're getting for that.
Which arm do you want?
We're going to use this arm.
Alright, okay. My heart rate is going nuts. I feel like my chest is really dizzy right now.
Okay, I got 130 over 90, which is good.
Yeah?
And you do have a history of hypertension, correct?
Mm-hmm.
What medication are you taking for that again?
I take the Lasix.
Okay,
And I have another medicine, but I don't know the name of it.
okay, all right.
I take it at home.
Okay. We'll try to see if we can get that figured out as well.
Okay.
I want to go ahead and check your O2, make sure that we have you in a high enough level.
Okay.
And get your blood pressure, temperature taken. Sorry.
Well, today,
Do you want me to move the mask over? Yes, please.
you need to stick it back in the hole, right?
All right.
Yeah, that looks great.
Your O2's coming in at 97%. 97.8 for your temperature. Good. I counted your respirations at 20, which is much better. I know you came in a little high for your breathing as well. I also want to take a listen to your lungs and your heart. Is that okay? Okay.
Can I sit like this?
I'm sorry.
Can I sit like this?
Surely you can. And then when I need you to sit up, I'll go ahead and use for that. Okay? listen to your heart. Got your heart rate coming in at about a 90, okay? And that's pretty good. Now, if I can have you sit up some, when I move my stethoscope, I need you to take a deep breath, okay?
Sorry, did you just see that? That okay.
No, I feel like I didn't think it was that bad. But he was everything he was saying. He's like, oh, I can't believe you're like, yeah, right now. Yeah, no, your spouse sounded great. Yeah, it was good.
Alrighty. Everything sounds pretty good, okay? Alright, so, as mentioned, I'm going to go ahead and start the medication for you. I do need to ask a couple of patient identifiers, make sure I have the right person. Can I have a name and a birth date from you?
October 15th,
Okay.
1960.
All right, good. Now, if you don't mind, I do need to take a look at your ID. Okay. All right, you're not having any pain, right? Tastes good. All right, so you're doing pretty good, okay? Said you already take Lasix as well, correct?
Yeah, I take it in a pill though.
Okay, and have they been giving you the pill form here as well?
Like maybe.
Yeah, they have.
Okay. Right.
Yeah, I thought you kind of knew. I thought you'd seen it. He didn't panic. He just freaked out when his vitals started.
What she said, don't necessarily, you go more, you develop your confidence, I actually thought, of throwing one of these in there.
That would be good.
So, in fact, if you have taken Lasix before, you know what Lasix does for you, correct? Alright, so,
All the fluid I have.
correct.
Okay. But anytime you say, that's three views from over here, or whatever,
Yeah.
Now, I do have to run this over 2 minutes, okay? So, feel free to give me some conversation, okay?
I can do that.
Alright.
I'm with Sarah.
Oh, 54, that's not bad.
Feels like it when you're sick.
So, okay, where did we work?
I was a secretary.
Oh, wow.
It wasn't exciting.
It wasn't exciting?
No.
I think I would kind of like a job sitting around quite a bit.
No, that's boring.
In front of a computer? Do you like computers much?
No.
No?
We didn't have them when I was growing up.
Oh, wow.
I lived in the old days where I had an outside toilet.
No, what did you?
I did.
We're not that old.
It wasn't until 5th grade when I got one
Okay.
inside my house. Did you like being a nurse?
I love being a nurse, actually.
How long have you been a nurse?
I've been a nurse about 3 years now.
Where'd you go to school?
I went to Indiana University Northwest.
I went there for a year,
Really?
but school wasn't my thing.
Oh.
So I became a secretary.
Well, what were you going for?
I was trying to go to be a medical assistant,
Oh, okay.
but I didn't want to go to school. I just wanted to be a secretary.
Well, what are you doing now? Are you retiring? What's the plans?
Hopefully soon.
Okay.
I have grandkids.
Oh, wow. What's their ages?
2, 5, and 7.
Well, not too bad. I have kids about that age, so. All right.
What are you doing?
I want to go ahead and check your legs as well. I know that you had some information in your chart in regards to having some swelling in your legs, okay? So if you don't mind, I do want to kind of check that, make sure that's a little better.
Sure.
I'm so sorry, but your legs are warm.
I'm very hairy.
All right. I see no swelling in your legs, so that is good.
Okay.
Okay?
What else do you have to do?
Okay, now I do want to recheck your lungs. Because we gave you that Lasix, I want to make sure that, you know, you're not having any adverse reactions or see if it's even working for you, okay?
Okay.
All right.
What do you want me to do?
You can sit there comfortably.
Okay.
We'll just do the same thing we did before.
Okay.
I can have you sit up some. Deep breath.
Oh, you know, when I just took that last deep breath, I got a sharp pain in my stomach.
Really?
Mm-hmm.
Okay. Now, let's go ahead and check that out. Lay you back a little bit, okay? How long have you been having this pain?
Well, I just felt it right now.
Just
But
now?
I've had stomach pain before.
Really? Okay. And what was that attributed to? Did you go to the hospital for?
Yeah, I was in the hospital. It was like, I think 6 years ago.
Okay.
And I had an ulcer that was bleeding.
Okay. And did they treat it then, or I mean, did they just say that you can possibly have flare-ups occasionally?
Uh-huh.
Okay. Let me go ahead and check that out, okay?
Okay. Oh, that, oh. I can just see touching me here.
Okay. 1 second, I'm going to listen, and then kind of pull around in there and see where it's at exactly.
Okay.
Yeah, the morphine they gave me, the ED. That's some good stuff.
When was the last time you had a bowel movement?
No pain.
What, 3 days ago?
Does it hurt there?
Yeah.
Okay. 3 days ago.
Yeah, I think.
Okay. I need to be sure. All right. Well, do you ever take laxatives, stool softeners, or anything like that?
I
No.
normally go regularly.
Okay. We're going to try to check on that as well. We want to go ahead and make sure that you're having bowel movements regularly.
Yeah.
And then also, I'm going to give Dr. a call, see if we can order some labs for you, try to find out what that pain is coming from, okay?
Right.
All right. So before I leave, is there anything else you need from me?
No.
All right, dear. I will be back to check on you later.
Thank you.